I wanted everyone here to quickly introduce themselves so we could get into the meat of the matter. I have given them very strict instructions that they're supposed to be quick and to the point in their answers, but they are also supposed to argue among themselves, because we learned from Mark earlier that that's how we'll get to truth and wisdom and action. Hopefully we'll be issuing challenges to all of you before this session is over. Short and sweet session that it is. Len, why don't we start with you to introduce yourself?
Good afternoon again. My name is Dr. Len Lichtenfeld, and I'm Deputy Chief Medical Officer for the American Cancer Society.
And I'm Mark Rosenberg, yet again, and I work for the Task Force for Global Health.
President and CEO. You do more than just work for them.
And I'm Frank Richards from the Carter Center, and I work for the Carter Center.
Yeah, you do more than just work. You're director of the River Blindness Program and malaria. And just.
Good afternoon, everyone. I'm Corinne Graffunder. I'm the acting Associate Director for Policy at the Centers for Disease Control and Prevention. My real job is the Deputy Director of the Policy Office at CDC. So it's a pleasure to be here.
So you're kind of doing two things.
I'm doing two, yes.
Double duty.
Double duty since February.
As some of y'all know, I'm an Atlanta native, and I take coming from Atlanta pretty seriously. And what does Atlanta stand for? We are known as the Center for Civil Rights and Human Rights. And from everything that I've heard, and we're taking a little bit higher look here, health is a human right. Health is a civil right. And in Atlanta, we have almost a responsibility to be true to who we are as a city and what Georgia is as a state, because I know Len cares a lot about folks in South Georgia, to make sure that we are living up to the ideals that were expressed by our former governor, Jimmy Carter, and by all the civil rights leaders in wanting to make sure that people are treated with dignity and with equality, and make sure that they have a fair opportunity to a decent life. What is it that we as a city and we as a state can do to live up to those ideals, to really become the place not only in our state, but our country and the world, to send the message and to actually make change? And answer in 30 seconds or less. No, seriously, and really I want this to be a conversation. What is stopping us and what can we do to really, all the pieces are here.
To me, I think all the pieces are here, and I think there's an unstated theme that I heard again and again throughout the day. And that theme, people talked about doing good as well as doing well, but I think the theme is social justice. And to me, Atlanta stands for social justice. And in my mind, there were so many times when people were talking about helping people, raising them up, giving them the power to take charge of their own health, enabling them to get better outcomes. And I think the social justice part is that in all we do, we're also thinking about how we benefit those who are least well off. And I, again, heard that as an unstated theme, but it was consistently part of the collaborations and partnerships we heard about.
Can I pick up on that?
Please.
I wonder, I heard all of that as well, and I guess one of the things that I didn't hear as much of was the grounding in community and how, in addition to raising people up, we also have to raise communities up and the health status of communities and have that engagement, have that empowerment across multiple sectors, multiple partners and players within communities. So I think Atlanta could serve as a test bed because we do have so many valuable assets and a lot of players in this space. But I think we still have room to go.
What do you mean, Corinne, raising a community up?
What I mean by that is really looking at the conditions at the community level and really focusing on community level improvements that have broad, well, you know, I'm from CDC, so have broad population impact. And I think we have models and examples from across multiple sectors, but we need to really bring those together and harness that so that we can get the kind of health improvement that we need.
Yeah, Lynn?
So let's talk about an inconvenient truth. We have incredible power seen here today, a lot of collaboration, a lot of terrific things happening, and we rank near the bottom of every ranking there is for healthcare in the United States of America. And the fact that we are not taking that as a serious message for action, I think is really something that we need to have a discussion about, raise awareness, put it higher on the radar screen. Not to say there aren't people trying to make a difference. I've heard talks, for example, Dr. Fitzgerald was mentioned earlier from the Department of Community Health, but we have the power, we have the knowledge, we have the people, we have the capability. We need the commitment to make that change. That's what you talk about, looking at communities.
So why, and Frank, I mean, I want to know what's the disconnect? If the people are here, I hear folks saying we want to make a difference. What's happening? Why isn't it happening? And I kept hearing health disparities. They exist. And Frank, I know you wanted to jump in, and I didn't want to interrupt you.
Well, I
Take him on.
certainly agree with your point about outreach and community. That was where I was with. I'm not going to take you on. I really think, you know, going to Eastern religion, the yin and the yang, that absolutely exists in Georgia. And to go back to Atlanta, the celebration recently was from Civil War to Civil Rights. And you mentioned the Civil Rights era, but let's not forget the sesquicentennial of Sherman's March to the Sea. And the fact of the matter is that the Battle of Atlanta is under-celebrated for the fact that had the Union lost, Lincoln would not have been reelected, and things would have been quite different. And the story usually that one hears is General Sherman under everyone's bed, and it's forgotten that on the other side, the yin and the yang, there were people, black Americans who were enslaved, were following him across, like Moses, across the state. So there is a great disparity in the way people think in Atlanta now, just as you point to the great disparity of a wonderful health system that has outreach, et cetera, and a state that doesn't seem to want to take support to implement the ACA.
You know, if I had to say one of the factors that contributes, I think David Satcher hit it this morning. This gets back to why we have such disparities,
Yes.
why we have such low ranking. It's poverty. Poverty is a factor of life in Atlanta. It's a factor of life in Georgia. It's disparate in how it's distributed racially, geographically. But I think if we can address poverty, if we can harness some of the apps, if we can harness some of the collaboratives to start to address poverty and its attendant problems of drug abuse, of unemployment, of alcoholism, of smoking, things that are associated very strongly with poverty, how could we tack that on to some of the collaborations and partnerships we're dreaming about and actually doing?
The American Cancer Society, a number of years ago, back in the mid, I guess it was in I'm forgetting already, but mid-2000s, did a substantial amount of research on the issue of health equity. And it wasn't just a matter of the ethnicity. It was a matter of income, it was a matter of education, And we found out, for example, that if we could reduce mortality rates in this country, all-cause mortality, 40%, if everybody had the same health behaviors as college-educated people. When you walk into the stores where I live, and you see the ads for the smokeless tobacco and the cigarettes, and they're ubiquitous all over, and you understand that we can't get, and the American Cancer Society and others have lobbied for an increase in the tobacco tax, which in turn would help fund some of the other programs that are necessary. And I assure you, I am not just singly cancer focused. We're talking about maternity, we're talking about healthy babies, we're talking about addressing care, that we have, for whatever reason, chosen not to take those on, then that's where we have a serious issue. We need education. We need to address some of these fundamental questions. We have the will. We have the way. Do we have the will? And we have politically decided in a number of arenas not to take that on because it's no touch, and that's a problem. That's a real problem.
Okay, so where is this no touch coming from? I remember when I was a big group of Atlanta business leaders went to Houston, and we saw the big medical complex there, and the head of the medical complex said, you know, we've got the best medical institutions, and we could argue about that, you know, in the country right here, but we also have the greatest poverty and the greatest disparities right here. We haven't bridged that gulf in Houston. It's the same thing here. I mean, it's almost like, why are we not, you know, making that leap? What is it, all of us in our ivory towers and, you know, not finding a way to be out on the street and figuring out how to do that the very reason y'all went into the fields that y'all went into? And I'm not saying you're not doing anything.
I mean, one of the speakers from earlier today talked about how even just within a particular health care one aspect of healthcare, it feels like it's a really large issue to try to address. And then when you start talking about poverty, so you could see where it starts to get overwhelming, but I think there are also incredible examples of how you can then turn around and break it back down to talk about what would it mean to have, we've seen amazing examples of collaborations today. Well, CDC also has a collaboration with Georgia Tech in their civic planning program, where you've got people who are planning communities of the future being trained to think today about how the cities that they're planning are going to promote and support health and well-being in those communities. That's a different version of a collaboration that is ultimately oriented to a health outcome that's a positive health outcome. It's a prevention and an early upstream health outcome. And the transportation field, the education, even the Department of Defense, we've done work with, they understand that they can't even recruit new recruits because of the obesity epidemic. So I think thinking beyond, we talk about the health system, not the health care system, and the health system includes community, public health, other stakeholders, as well as the health care system.
Well, in urban planning now, they talk about developing healthy communities, and that's not just, healthy cities.
It's not just health.
It's not just.
It's not just health. The social determinants, as were discussed earlier today, go into areas. We have highway systems in this state because somebody realized they were economically necessary for development throughout our state. So we can have plants and activities in many parts of our state. We do have investments in technical education to help improve our state. We really need to, it's about systems, and it's not just health system when we talk about what we're talking about. It's political, it's educational, it's engagement to make sure that people have education, they have opportunity. It starts with healthy babies. It starts with children, it starts with mothers, and it goes from there. And that's the kind of commitment that we need. And I know there are people out there who probably may not agree politically or may make, believe me, I understand the politics. But we have to get to a point where we say we are committed to lifting these boats through a variety of approaches to make sure that every child has an education, that every mother can have a healthy baby, to make sure that people have access to the care that they need, they can identify a healthcare professional, and then we can go from there.
I think that David Satcher and Helene Gale talked about some of the social and economic determinants of health. And I thought we heard some spectacular collaborations on biotech, on health tech. Bill Todd's panel talking about cancer and what's been done in that area. But I'd like to see maybe Health Connect South incentivize some collaborations to address the social and economic determinants of health. They are so important. And I would venture a guess.
So give me an example. How could Health Connect South incentivize?
You get grandmothers who are raising grandchildren in homes without that middle generation. You get them to work together with some people from Georgia Tech. How can we supply the things that grandmothers need to raise healthy children, improve their well-being? There's an effort like this at Georgia State, but that's not where the focus of the young innovators is. I suspect that most of our young innovators don't come from poverty. We heard about some striking examples, some do, but I bet most don't. How can Health Connect get some resources to bring in inventors, innovators, connectors who grew up in that background, who understand some of the reasons why Georgia has such poor performance in the health indicators?
A few years ago, several years ago now, Bono came to Atlanta, was honored by Coretta Scott King at the Salute to Greatness dinner for the King Center. And he challenged everyone there. He said, look, you help solve the civil rights issue in the South. He says, but there are black children dying throughout Africa, and you have a responsibility to the world to do what you were able to do in the South, and to help Atlanta. You were able to change the world, the influence, the impact you had on my life, and the teachings of Martin Luther King, and how that helped me figure out what was going on in Ireland. Now you have a responsibility to take that to the world. I look at the work that all of you are doing, and you are doing that and taking it to the world, and yet in many ways it's not being harnessed and leveraged to the full extent that it possibly can be. And I know it's I'm trying to save the world and all this kind of good stuff.
I mean, I guess, the theme is a call to action. So the question
Right.
for Health Connects is it a networking? Does it facilitate discoverers and deployers and developers to talk the same language? And is that what it's about? Or is it going to have a broader agenda? And that agenda really is one that I wonder if this community is willing to take on, and that involves a political agenda. It may simply involve some statements of principles that we would, at Health Connect, can all get behind as a community. And if a degree of activism comes from that later, well, it would have to be step by step. You're talking to people who are 120% committed. And most people here do feel like they're doing something to change the world. Most people do feel like they're exercising the love, 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 all you need is love. But, I think, perhaps...
I asked Mark if he would just sing for us. I mean,
You don't want to hear me sing.
But I do, I think it's a level of conversation for the leadership of Health Connects, and how does it go beyond...
simple networking? Or
yeah,
is
is it an
So
advanced
let me ask you,
LinkedIn within the community, or is it really going to be something more than that?
And so I'm challenging y'all. I'm saying Atlanta stands for something. Atlanta has had a grander agenda in history, that it should have that broader agenda.
I think we still do. I think we opened by seeing one of the Ebola patients who was brought to Atlanta. And I would put forward the hypothesis that in Atlanta we believe in love, yes, but loving someone by itself may not help them. Compassion and consequential compassion that has consequences. So the Ebola patients who were brought here really helped us focus on the problem, and it spread attention to the problem, but it also brought up a real dichotomy. There were some people who were mostly concerned, is this going to get us sick? Is this going to threaten us? Because our main duty is to protect the people here in Atlanta and the people in the United States. That's our interest in Ebola. But there were some other people who said, well, our real interest is in them over there. They are sick and they are dying, and their dying diminishes me because I care about them. And we had this dichotomy. Is it that we care about them over there, or we're worried about us over here? And what I think Atlanta showed was that the way to protect us here is to prevent the illness there. Prevent it there is the way to protect us here. It serves both of us. It's of mutual benefit. It's in our mutual interest. And I think what happened in Atlanta, Maria, that you talked about, black and white coming together, was done because of mutual self-interest. I think it's a guiding principle, and I think it's time we can apply it to the world stage.
But it takes certain enlightenment to make that point. I mean, and it's like you were saying, be careful about the political. It gets political, but is it really political to say we should have healthy children? That we should have healthy communities? I mean, you were going
But I don't
that
see
was-
your statements being either or.
I'm sitting here because I'm just sitting here and I said, I hope the governor's listening, because Governor, I really like the state of Georgia and I really admire Atlanta. So I want to get that out there if I can.
Okay.
It really is a great city and it really is a great state. And I don't want anything I've said to suggest otherwise. I'm honored to be here, and I mean that sincerely. But
Okay,
let's talk about cancer care in the city of Atlanta when 1 in 7 women diagnosed with breast cancer can't get care. Let's talk about the breast and cervical cancer early detection program where 1 out of 5 women in the state either can't get a mammogram or a pap smear or has to wait inordinately long to get it. Those are not, to me, I think to most of us, those are non-political statements. Those are systematic issues with the delivery of health care that fundamentally all of us agree that no one should be turned away if they're diagnosed with breast cancer and not be able to get that care. The root cause analysis of that problem, putting solutions into place, is something that should be within the scope of this collaboration to get those problems solved. And I think that is not political. That is human, that is fundamentally humanity.
So I'll disagree with you because a lot of people do not believe that health is a human right.
I didn't say it was a human right.
It's been a consistent
It's
debate
humanity.
in our Congress.
And I said that. I started
Yes.
that.
Well, I believe it.
I try to
I bet
avoid that
everybody here
argument. I
does,
try
but-
to avoid that argument because I didn't want to label. I'm not here to make a label. I'm here to make a
Okay.
fact.
Well,
How one chooses to look at it, avoiding the label means the solutions are at hand. And if you say this is something that should not be happening, then let's have a solution. We can agree on that. I hope everyone can agree on that particular point.
So how do we overcome that political divide then and work on solutions?
There are a lot of
that
smart
should-
people in this room, and there are a lot of smart people in this city, and there are a lot of smart people in this state. And I can't imagine that we don't have the will to make that happen.
Yes, you seem to.
oh no, I'm looking at
Go for
a
it.
different angle.
Go.
I mean,
Go
that's
for it.
fine. We'll agree to disagree. I mean, I think everybody
Hey, that's what makes a good marriage.
can
Come
say
on.
that's fine. Just,
Even though Len says.
no, not according to,
I like you, but you know.
not according
Hey,
to
I'm
here.
not going to advocate gay marriage here.
Yeah,
Let's make the members of Health Connect South ambassadors.
Well, I mean,
Let's make them ambassadors for some equity, for some improved health care. Deploy them.
yeah.
Isn't that your term, Frank? Deploy them.
Deployment. Yeah.
Deploy us.
Deploy Health Connect attendees.
and,
Who all wants
and
to be
similar
ambassadors?
to that
Are
notion,
y'all willing to be
and coming back to the,
ambassadors? Okay, come on, let's hear. Ambassadors, anyone?
right,
Okay.
indeed.
Would that make you happy?
No, I mean, I
No.
just,
Okay,
I
so
really
nothing.
look
Nothing will make Frank
Nothing
happy.
satisfied. I think, coming back to the Ebola issue and certainly the enlightened self-interest, would Health Connect serve as a response network, if indeed you needed a response network in this area? Can these different connections, if we were to have a public health emergency, I know that CDC has its emergency plan, et cetera, but just in looking at the call to action and what Health Connect might do, aside from networking, aside from having a political agenda and having ambassadors behind that agenda, that platform, my question is, could this serve as a response network?
Or as a way to mobilize the resources that are represented.
Well, that's what I mean.
Yeah, that's,
Yeah.
And Corinne, I mean, here, the CDC has emergency plans, has strategies. Could you see you, Ms. Strategic Mind, coming up with a way that you could advise all these great ambassadors that have now agreed to sign on how to
I think we
To deploy
could.
them.
I think we could. I think what I would want to challenge us to do, Health Connects to do, is to think about how we do it in those areas where it's not as commonly held as an emergency, in the same way that an infectious disease, that, the core challenges in our communities that contribute to the health status of the people in the communities. I think, can we deploy the same kind of urgency and I think we can, but I think it does take the leadership that can come from this
and
kind
I
of
think
group.
it's, having been a bureaucrat for 20 years, I worked for CDC, my secret comes out, for 20 years, and I was proud to be a bureaucrat and to serve. But I think it puts Corinne and I think puts CDC in a difficult position. She can't speak for Tom Frieden, and she can't speak for Congress, and she can't speak for the President of the United States, who'll be here tomorrow to speak to her. But this is
That'd
exactly.
be nice. Maybe he can come and be an ambassador.
This deployment is exactly the reason we need a partnership.
Right.
So Frank's idea of deploying the resources here for an emergency, and maybe the emergency is women are dying in epidemic numbers of preventable breast cancer. Maybe that's it. But maybe it's a partnership between CDC and Health Connect South.
Children are dying, right? I mean, it's not, you can pick any group.
Or they're
I've
just not
noticed
thriving.
it's not
Do you
thriving.
see what I mean?
And I guess
think
I'm-
I keep wanting to move it to a conversation around how do you create positive health status before you get to the negative related conditions that come from not having the right conditions in the place in the first place. So I think I just want it to keep trying to at least move some part of the conversation in that direction as well.
Yes.
One last possible call to
Please.
action.
Okay.
I found it very interesting that in the day when George Bush decided that the NIH shouldn't fund certain kind of stem cell research, that certain states, to not lose the cutting edge, decided that they were going to invest in those things. California, later Massachusetts. If this is such a strong opportunity that people have talked about here in the Atlanta area, then why wouldn't perhaps the state invest in it? Why wouldn't there be some seed money for those people who can't get NIH grants to like Massachusetts has done, like California has done, to continue to reinforce that? That should be something we should advocate for.
Or if the state won't invest in some of these things, what if the private sector or the philanthropic sector?
Well, if it's a good story that needs to be told,
I mean,
as a result
I'm
of
just
telling what do we
saying,
want to get, that
no.
should be the idea.
The state is not always there when it comes to certain funding for the arts.
Could work
or-
on that.
That's
Anyway,
why we
did I
have
say
collaboration.
collaboration?
Public-private
Yes,
partnerships, I
okay.
think that was it.
I don't want to take up too much of our time and go over, but I knew that this challenge was going to take longer than the time we had allotted. Let me just repeat some great thoughts. The theme that we've heard today is social justice, and Atlanta stands for social justice. Atlanta can serve as a test bed to raise a community. There is incredible power here, and yet we rank near the bottom of nearly every health ranking. We have the power here to make change. And yet we're a state that represents from Civil War to civil rights. It's a yin and yang. We're a state that doesn't want to implement ACA. Poverty is at the core. We have to harness what's here to address the issues of poverty. We have to have the will to make a change. It can feel overwhelming, and yet we have to come up with different forms of collaborations. It's all about systems. It starts with healthy babies, and it moves all the way up. We are committed to lifting people. Said folks, but people. There are social and economic determinants of health. Health Connect South can incentivize programs. How can Health Connect get innovators to be involved? Is there a broader agenda? Is this community willing to take on a broader agenda? What if it involves a political agenda? In Atlanta, we believe in love, but we also believe in compassion. There's a dichotomy. Do we care just about protecting ourselves, or do we believe in preventing illnesses in other countries, or is there a mutual self-interest? Do we understand that as we did during the civil rights movement? Cancer, taking care of cancer, it is a non-political issue. Putting solutions in place does not have to be a political issue. Let's deploy Health Connect South and the attendees as ambassadors. We have to address our core challenges with urgency, even if it's not an emergency. How do you create a positive state of health? It doesn't have to be all negative. This is a strong opportunity. Let's rise to the challenge of Atlanta, and let's live on and continue its role as a center of civil and human rights with health at the center of it. Thank you so much. Thank our panel.
Thank you.